Welcome to today's webinar, an evaluation of Texas opt-in policy for sex education and abuse prevention. Thank you very much for joining us. My name is Dr. Andrew Springer, and I'm an associate professor in health promotion behavioral sciences at the UTHealth Houston School of Public Health in Austin. Today's webinar is hosted by the Michael and Susan Dells Center for Healthy Living at the UTHealth Houston School of Public Health in Austin. The center's vision is healthy children in a healthy world, and its mission is to advance health and healthy living for children and families through early and impactful interventions. Our center intends to create new research ideas and enable a workforce through public health student training, communicate data-driven and evidence-based products and outcomes to researchers and policymakers, and connect with other public health organizations, community organizations, and policymakers. I would like to recognize that the center's activities, including today's webinar, are made possible by the generous support from the Michael and Susan Dell Foundation. Information about much of our center's work can be found online, including center resources listed here. Please scan the QR code on your screen to learn more about our resources. We also have legislative-related resources described on the slide. You can scan the QR code to learn more here as well. Well, before we get started, I'd like to make just a few brief housekeeping announcements. First, the webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. If you have any questions during the presentation, please enter them into your questions chat box. We will have a few minutes toward the end of the presentation for Q&A. So, without further ado, I am very excited to introduce our speakers today, Dr. Melissa Peskin and Jen Biundo. Dr. Melissa Peskin is an epidemiologist and behavioral scientist with over 20 years of experience conducting research focused on the determinants of adolescent health risk behaviors related to sexual risk-taking and violence, including bullying, aggression, and dating violence. She also has extensive experience designing, implementing, and evaluating health promotion programs for youth. She has been PI or co-PI, principal investigator, on several large randomized controlled trials to develop, evaluate, and disseminate these programs. And examples of these programs include It's Your Game, Keep It Real, an effective adolescent sexual health program, It's Your Game Tech, the internet version of It's Your Game, and Me and You, Building Healthy Relationships, an effective healthy relationships and dating violence prevention program for middle school students. She was also the principal investigator of a study to develop an online decision support system to help school districts adopt and implement evidence-based sexual health programs. Jen Biundo is the Senior Director of Policy and Research for Healthy Futures of Texas, where she works to support access to sexual health information and services for Texas youth. She earned her master's degree in public affairs from the LBJ School of Public Affairs at UT at Austin and holds a certification in public health. She previously served as an analyst on the Texas Legislative Budget Board, working on public health and public education. She's also the proud mom of 2 school-aged boys, including a high schooler who kind of wishes his mom had a normal job that didn't involve sex education. But Jen and Melissa, we are happy you are with us. Our public health field thanks you. So I am going to now hand it over to Melissa and Jen to start their presentation on the evaluation of Texas opt-in policy for sex education and abuse prevention.
Thank you so much, Andrew. It's really a pleasure to be here today. Again, I'm Melissa Peskin, and I'm thrilled to be joined by my colleague Jen Biundo today, and we are excited to share the results from our evaluation of the Texas opt-in policy for sex education and abuse prevention. So before we get started, I just wanted to acknowledge our team. We have a very large multidisciplinary team from UTHealth Houston School of Public Health and also Healthy Futures of Texas. And I just wanted to acknowledge everybody's important work on this initiative. So just briefly, an overview, we're going to go over a background, talk about the methods we used, talk about the results and discussions and key findings, next steps, and then close with some resources. So I will turn it over to Jen.
Thank you so much, Dr. Peskin. It's really a pleasure to be with y'all, and thanks everyone for spending your lunch hour learning about sex education in Texas. So go on to the next slide, please. So to kick us off, I just wanted to talk a little bit about why we're doing the work that we're doing and why high quality sex education is so important for our youth in Texas. So as many of you who work in public health probably already know, we have actually seen tremendous declines in the teen birth rate in recent decades. From a public health perspective, it's really been an extraordinary phenomenon. But Texas still continues to have persistently high rates of teen birth. We had the ninth highest rate of teen birth in the nation in 2021, which is our most recent year of data. And we do see that teen birth rates are actually highest in our rural counties, especially those in South and West Texas. About 2% of Texas teens gave birth in 2021, which equates to a baby born to a teen mother once every 25 minutes here in Texas. We also have one of the highest rates of repeat teen birth nationwide. About 1 out of 6 teen births are not the teens first. So we do see that we've got declining rates of sexual activity among Texas youth, but we still see that by their junior year of high school, half of Texas teens report that they've been sexually active, and by the time they're seniors, that rises to 2/3. And despite this tremendous decline in teen birth rates, we are seeing significant increases in rates of sexually transmitted infections, and a majority of those newest STIs are to people younger than 25 years old. Next slide, please. So where does sex education come into this? So a strong and long-standing body of research supports evidence-based sex education as being protective of adolescent sexual health in terms of things like prevention of unintended teen pregnancy and sexually transmitted infections, and then also supporting things like healthy relationships. We often in our field talk about evidence-based sex education. And so an evidence-based sex education program is grounded in strong research methods, and it's been rigorously evaluated to show evidence of positive behavior change that persist over a period of time. And that's really the important key factor in evidence-based sex education, is we want to see that it does show that positive behavior change. This is the best way to make efficient use of our limited resources. These evidence-based sex education programs often can be grabbed off the shelf. They're already available, they're ready to adopt and ready to use. Next slide, please. All right, so what is the landscape of sex education in Texas? So we use the term sex education, but typically we're talking about health education. That's uppercase health education. And this is a Texas course which has a set of minimum curriculum standards known as the Texas Essential Knowledge and Skills, or TEKS. So health education is taught at all grade levels, right, from kindergarten through high school, and it covers a lot of different factors, right, like nutrition and healthy friendship and physical activity, right, all of this information that we want our kids to have to be healthy and safe. Health education is part of our enrichment curriculum, as opposed to our core curriculum of English, math, science, etc. Now, health education is required to be taught at the elementary and middle school level, but it's elective at the high school level. So as a result, many high school students don't take health class, and in fact, many districts don't even offer health class. However, we have a new set of health education curriculum standards. These were adopted by our State Board of Education in 2020, and they went into effect in the 2022-2023 school year. A lot of folks in the public health field, in the education field, worked very, very hard to make these new standards as strong as they could be. And one very important improvement that we saw with these new health education standards is that we've taken basic age-appropriate sex education content on topics like contraception and STI prevention, healthy relationships, and we've added this content to the 7th and 8th grade level when, in theory, all Texas students should be receiving this content. So those are the standards that are adopted by the State Board of Education. We also have a significant amount of statute in our Texas Education Code that lays out regulation and policies regarding the provision of sex education in public schools. And we saw major changes to the statute in 2021 in our 87th legislative session. So next slide, please. All right, so what happened in 2021 in the 87th session? We saw the biggest changes to sex ed that we've seen in decades. In our regular legislative session, as part of the school finance bill, we saw major changes made to sex education. And then in the second special session, as part of SB 9, we saw these same changes applied not just to human sexuality instruction, but also to any instruction on the prevention of child abuse, family violence, dating violence, or sex trafficking. We could spend a whole hour talking about just these two bills, but at a very high level, the biggest change that we saw in these bills related to the implementation of opt-in provisions that we're going to be talking about today. We also saw expansion of parent rights around notification of the curriculum, expansion of parent rights to purchase or review curriculum. We saw a more formalized process that school districts have to go through to adopt curriculum for sex education or abuse prevention. And then we also saw changes to meeting procedures for our school health advisory councils, which are volunteer groups that helped adopt the curriculum. So next slide, please. So the biggest policy change, and the one that we'll be talking about for the next hour, is the opt-in policy. So before this law change went into effect, parents had the right to opt their children out of sex education if they didn't want them to participate. After this law change, we now require written parent consent in order for students to participate in sex education or abuse prevention instruction. We're one of just 5 states requiring this opt-in for sex ed, and to our knowledge, we're the only state in the nation requiring written parent or guardian consent for abuse prevention. Next slide, please. So a little more detail on how this policy plays out in the classroom. We require the consent forms to go out at least 14 days before the start of instruction. One major barrier that we're seeing impacting school districts is that these permission slips are not allowed to go out with any other documents other than the required notification form about sex education. This means that districts can't put this into the beginning of year registration packet, for example. Because of the way that this bill language was drafted, we've got these 2 permission slips for sex education and abuse prevention, which are typically taught in the same classroom, potentially even on the same day. These 2 forms can't even go out with each other. We require consent for all instruction on human sexuality, which is defined in state law in a somewhat vague manner as instruction in reproductive health. We also require these consent forms, again, for any instruction that touches on the prevention of child abuse, family violence, dating violence, or sex trafficking. Now, it's important to note that these laws apply to sex ed that's offered in an independent school district, an ISD, but it does not apply to charter or private schools. Next slide, please. So we definitely see some challenges and some concern with these new laws. The biggest concern, and I say this as a busy mom myself, is that parents may simply overlook the form in the bottom of a backpack or in an email inbox. You know, when I think about the things that I've fished out of my own children's backpack 2 weeks late, this definitely gives me concern. I will put myself out there as an example. I am the mom who left the permission slip for my child's bicycle field trip sitting on the printer, and my child didn't get to go on the bicycle field trip. And my hope is that by the time he's a legal adult, he will have forgiven me for it, because I certainly hear about it all the time. And I'm one example, but we have a wide, longstanding body of research that shows that this type of active consent requirement could result in students not participating, not because the parents actually object to the content, but just because they have trouble with the paperwork. And in fact, public opinion polling consistently shows that parents have very strong bipartisan support for sex education because they perceive of it as being something that will help keep their children safe and healthy. And that's what we want as parents. Additionally, research shows that parents who are most likely to struggle with this type of active consent are low-income parents, parents whose language may be something other than English, and in fact, these are some of the groups of students who are most at risk of things like unintended pregnancy or sexually transmitted infections. Requiring these consent forms for abuse instruction is especially concerning because in cases where students are being abused by their parents or legal guardians, they may be in a position where they are asking for permission from their abuser to learn about child abuse. And then finally, there's really not a built-in mechanism to know how this is going. We don't have any statewide oversight of this opt-in process. And indeed, we have minimal statewide oversight of sex ed. Like we like to say in my field, we have no STAR test for sex education. And so that leads us to the research that Healthy Futures of Texas and the UT School of Public Health joined forces to complete. And on that note, I will turn it back to my friend and colleague, Dr. Peskin.
Thank you, Jen. So now I'll talk a little bit about the evaluation that we conducted, and I'll first just talk briefly about the methods we used. Next slide. So we evaluated the opt-in policy using an online survey that we distributed from June through September of 2022. The survey assessed perceived attitudes, behaviors, experiences implementing the new policies, and parental permission form return rates for 2022, which was the first year that the law was supposed to be in effect for schools to follow. So next slide. So eligibility criteria, we just wanted to make sure that we were talking to school representatives. So in order to participate in the survey, a participant needed to be a representative of a Texas public independent school district, public school, charter school, or private school in one of these capacities here that's listed on the slide. And we reached out to several statewide and local contacts to obtain our sample for the evaluation. Next slide. And then we conducted quantitative and qualitative data analyses. For the qualitative data, we had several open-ended questions, and that's what our qualitative data is based on. So next slide. So I'll talk first about the quantitative results, so from the actual survey items. Next slide. So we received responses from about 228 people, and of those responses, we had 152 school representatives who were actually eligible to participate in the survey from over 90 school districts in Texas. We had a variety of people who were included and said that they were part of their roles. So we had district and school administrators, health or non-health teachers, counselors or social workers, school nurses, and a curriculum coordinator. And we did have people did indicate representation from all political affiliations. So next slide. The sample comprised predominantly of public schools or independent school districts, and we had approximately equal distribution among all school geographic areas, including rural, suburban, and urban. Next slide. So when we asked first, we asked survey respondents, did you actually implement sexual health education during the 21-22 school year? And we found that a little over half, so about 55% of respondents actually reported implementing sexual health education during the 2021-2022 school year. They reported a combination of about 24 programs being implemented, and programs that were most commonly reported being used were Choosing the Best Path, Big Decisions, textbook or instructional materials, and Worth the Wait. So next slide. So among these implementers, we also asked them what type of parental consent policy they implemented during the 2021-2022 school year. And we found that about 60.9% of respondents indicated implementing sex education with an opt-in policy. A little over a quarter of participants reported implementing sex education with an opt-out policy, and about 13% reported not knowing what type of policy they used in their school district. Next slide. So in terms of getting permission forms returned, and Jen alluded to this earlier, respondents reported various methods that they used to distribute permission forms. People who reported using the opt-in policy utilized more distribution methods than those implementing opt-out. And people who reported having the opt-in policy indicated that obtaining permission forms was more time intensive. A little over 40% stated that the opt-in policy was difficult or very difficult to obtain parental consent, and almost 7% in comparison indicated that opt-out was difficult or very difficult in terms of obtaining parental consent. Next slide. So we also asked people about their attitudes toward future experiences of the opt-in policy, and also about how they experienced the opt-in policy during the 21-22 school year. And so for the 21-22 school year, respondents, about half of respondents, a little more than half, perceived the opt-in policy to be a barrier for implementing sexual health education. And when we asked them, how do you think the opt-in policy affected student receipt of sexual health education in the 2021-2022 school year, most respondents perceived a decrease in students receiving sexual health education in the 2021-2022 school year. Interestingly, we found that about 40% of respondents really couldn't tell us how their students were being affected in terms of whether sex education increased or decreased. So next slide. So the majority of respondents really did report viewing the opt-in policy as a barrier to sexual health education in the 2022-23 school year. And this was them looking forward towards that school year. So most respondents perceived that it would be difficult or very difficult to obtain parental consent in the 2022-2023 school year. And again, they were doing this survey before that school year started. So, and 80.6% believed the opt-in policy would be a barrier. And we also asked respondents to think about how this policy would impact children in the child welfare system. And we also found similar statistics there. Next slide. We also asked about their preferences. So what would you prefer in terms of sexual health education and abuse prevention in terms of the opt-in policy or opt-out? And we found that overwhelmingly, more respondents indicated having a preference for opt-out for sexual health education. So about 70% reported a preference for opt-out for sexual health education. About 20% reported a preference for opt-in, and 10% reported no preference. For abuse education and their consent policy preference, about 65% reported a preference for opt-out, 24% reported a preference for opt-in, and 11% reported a preference for reported no preference. Next slide. So we also attempted to obtain actual permission form results, and this was very difficult. It was very challenging to obtain this information because there really isn't any systematic data collection, but we asked school districts if they had this data, if they could report it to us. And so out of the 152 respondents, only 8 were able to provide this data. And this is certainly something that we're looking towards trying to learn more about as the years progress. But from the data that we obtained, we found that total parental permission form return rates ranged from 32.8% to 100% among middle schoolers, and then 2% to 76.6% among high schoolers. So a big range. And so we really need more data to really understand this trend. But one very interesting finding was that among parents whose child did return a parental permission form, the vast majority provided permission for their child to participate in sexual health education. So next slide. So I also want to share some of the qualitative results, and these were results that we obtained from open-ended questions that we asked on the survey. And we got a lot of really rich data from these questions. So again, qualitative data collected from open-ended questions that asked participants to share their policy preferences, so opt-in or opt-out, and the rationale behind these preferences, and then to really elaborate on factors that influence their implementation of sexual health and abuse prevention education. And I just want to acknowledge Dr. Marie Bro, who really took the lead in organizing the qualitative data. So I'll report on those results now. Next slide. And this is the methods that we used. So we identified several themes for the qualitative data. We identified themes related to barriers and facilitators to sexual health education in the 21-22 school year. And so we had respondents talking about barriers and then also facilitators and lessons learned. We also identified a theme related to attitudes and preferences for opt-in versus opt-out policies for sexual health education. And some sub-themes here are that the opt-in policies for sexual health education present another challenge to parent-school communication. The opt-in sexual health education policy may widen socioeconomic and health disparities, and participants with mixed or supportive attitudes towards opt-in policies for sexual health education highlighted parental rights to access and veto curricula. And then we also reported on attitudes and preferences for opt-in versus opt-out policies for abuse prevention. And one of the sub-themes that came forth here were that opt-in policies for abuse prevention education may have implications for student safety. And so I'll talk a little bit more in depth about each of these sub-themes now. So next slide. So regarding barriers to opt-in policies for sexual health education implementation, many respondents reported on the additional administrative burden caused by the opt-in policy, and they indicated that obtaining parental permission under opt-in was time-consuming, detracted from school officials' time to work with students. And we have some quotes here, and I'll just read a few. So from one district administrator, in a public school, they indicated that chasing the paperwork for opt-in is very time-consuming, and staff could be spending their time directly supporting students instead of paperwork. And then over on the right here from another district administrator, indicated opt-in places more unnecessary burden on campus personnel who are already stretched beyond capacity. And then we also had a quote here from a SHAC member as well. So next slide. Additional barriers to implementing sex education under opt-in. Participants reported that under opt-out, schools had fewer students without parental permission to make alternative arrangements for. However, under opt-in, schools had more students without parental permission to make arrangements for. And so this left some schools with too few students to really warrant a sex education class. And they also reported that implementing opt-in sexual health education requires additional guidance and resources. So we had some quotes here from district administrators, and for the quote on the right, if I had a class of 40 and only 5 opted in, how do I justify teaching only 5? What do I do with the other 35? When it's reversed, you can work with someone to take on the small group. So next slide. So in thinking about some facilitators and lessons learned from implementing opt-in policies for sexual health education, we did have a subset of respondents who shared approaches to improve their participation rates in sex education. And really what came across was the need for a multi-pronged strategy for delivering permission forms directly to the parents. So not just one strategy, but using email, school registration forms, in person, multiple strategies needing to be used here. And one participant explained that their school had always used Optin and offered a variety of suggestions as to how they obtained signed forms. So we received, again, a lot of comments, and one of them, I'll read the one on the left here, from a counselor or social worker. Because it was a new option, I think students and or parents did not feel comfortable committing to it. We should have had many more students participate. This year, we will make the parent permission letters available at Meet the Teacher so that it can be completed and turned in before leaving campus. We will also have the curriculum available for reviewing. And then a counselor or social worker here in the middle said, we've always done the opt-in policy and it's not hard. And this person goes on to talk about the different methods that they've used in order to encourage students to return their forms. So next slide. We also found that opt-in policies present another challenge in parent-school communication. So the majority of qualitative responses did express a preference for opt-out, and the reasons participants expressed a preference for opt-out centered on parent-school communication. And so challenges associated with obtaining permission from parents, busy or less engaged parents rarely receive or complete forms sent home concerning any topic. And parents do not know that permission is being sought. And so when parents do not complete the permission form, it's not necessarily because parents are making an informed decision to withdraw their children from sex education. They simply don't see the form or don't know that this is happening. And so there's really limited parental education or a notice of the change from an opt-out to opt-in. And so that also resulted in confusion on the part of school administrators and school personnel and also parents as well. So one quote here, if parents have a definite opinion of not wanting their child to participate, they will send back the opt-out. I don't think that all parents really read the notice and don't understand the importance of returning the form. Most of the ones that returned the form opted in. Our biggest problem was getting the forms brought back. So next slide. We also found from the respondents that the opt-in policy, the opt-in sexual health education policy may widen socioeconomic and health disparities. So respondents framed their preferences in terms of disparities and the value of sex education in mitigating these disparities. Participants reported that an opt-out approach allows more students to receive sexual health education. And respondents preferring opt-out indicated that schools are maybe the most credible sources for sexual health education, and that students who may have greater informational needs may also have parents or guardians who are unable to meet these needs. And from a counselor or social worker here on the left, indicated that students on my campus are dating and are not receiving guidance at home. They are being exposed to material that does not teach them how to determine or defend their expectations. So they need to hear research-based information in order to protect themselves. I believe very strongly in providing information to middle school students who are at risk. And other quotes here that you can read as well. So again, regarding widening of socioeconomic and health disparities for specific communities, respondents noted that several communities experiencing structural vulnerabilities that may be particularly impacted by opt-in, including LGBTQ+, students that speak English as a second language, low-income students, and students with absentee parents. And these were groups identified by respondents as having specific health needs that must be addressed in sexual health education curricula. So one counselor stated on the left here that schools such as mine have additional barriers created by an opt-in system, such as parents that may have limited or no literacy skills, English as a second language speakers, cultural barriers, and just the general return rate we get for parent, which for parent compacts, permission slips, and other forms we send out. And you can read here the other quotes as well from a counselor or social worker and as well as a district administrator. So next slide. So participants with mixed or supportive attitudes towards opt-in highlighted parental rights. And these respondents felt that opt-in ensured that parents were more informed about the content of their child's lessons, and felt that opt-in provides parents with better insights into their school's sexual health education curriculum. They also felt that opt-in gives parents the oversight that they deserve, and we were really unable to discern whether opt-in was more preferred among those from public or private schools in the qualitative data. And we had a variety of responses here as well, and I'll just point out one here from a health teacher in a private school who indicated that both sides have pros and cons. My worry is parents feeling that they aren't informed enough if we use opt-out. So next slide. And then finally, opt-in abuse prevention education. Some respondents reported may have implications for student safety. So respondents were less ambivalent in their views in the qualitative data regarding in their views towards opt-in for abuse prevention education. Really what we found from respondents were that safety concerns were prominent in qualitative responses towards opt-in for abuse prevention. Equity issues also emerged here, as requesting parental guardian permission may place abused youth at greater risk. And so here on the left here from a SHAC member, one person indicated that abusers will not grant permission to abuse children. And then here on the right from a SHAC member at the bottom here, I have concerns that parents don't have the time or energy to send in forms. I have concerns that students who need violence prevention, sexual abuse, or trafficking prevention education may not get the education they need if the parents are violent or trafficking, etc. at home. It doesn't make sense that the parents have to opt in for this curriculum. So next slide here, and I will turn it back over to Jen.
Great, thank you so much, Melissa, for that. And go on to the next slide. So the key findings that came out of this report really were that a majority of respondents viewed this opt-in policy as a barrier to the receipt of sex ed and abuse prevention instruction. And these school-based stakeholders who work with our Texas students overall prefer an opt-out policy. There's also the broad-reaching concern that the opt-in policy is particularly harmful for low-income students, ESL students, or students with absentee parents, and could in fact widen socioeconomic and health disparities. My organization, Healthy Futures, does participate in health instruction, and one of our health educators who works in a very low-income Dallas school would share stories with me, and she said she had a student who wanted to take her sex ed class and came to her asking, and our health instructor said, well, we don't have your opt-in form. We're not allowed to teach you. You need to take this form and get your mom to sign it. And the teenage girl said, Miss, I haven't seen my mom in 2 weeks. So we found this in the research, and we also see this reflected on the ground, that this is really a barrier for our low-income students or students with absentee parents. And then finally, we did find concern among respondents about the abuse prevention opt-in policy being a particular barrier for abused youth and potentially placing them at heightened risk, as abusers are not likely to give permission for the students to learn about abuse. And next slide. We also heard respondents saying that obtaining parent consent was time consuming and took away from instructional time. And so, of note, we were asking respondents to reflect back on the 2021-22 school year. And this was a particularly difficult time for all of our public education folks. This was really the first year back from COVID. We saw students coming in with significant issues related to behavior and mental health. We had huge issues with teacher retention and workforce. So it was really kind of a perfect storm to make this particularly difficult in that 2021-22 school year. And then finally, respondents found that when parents don't return permission forms, it's not necessarily that they're making an informed decision to withdraw their child, but rather that the parent may be experiencing challenges such as the lack of awareness time engagement, or native language to return the permission slip. All right, so what's next? So, I'm a policy person, and when I look at this research, I want to see how this research supports policy and advocacy and what the next steps should be. So go on to the next slide. So the findings from this report. First off, we need this data. We need to know what's happening on the ground in order to craft good policy. So our first policy recommendation, both a lowercase policy P and an uppercase policy P, is to encourage school districts to actually collect this data on parent permission response rates. And we're especially encouraging districts to collect response rates on parents who grant permission, parents who refuse permission, and also parents who fail to return the form, so we can really have a clear sense of what is going on there. This research also really flags some of these administrative barriers that prevent schools from easily distributing the permission form, such as the prohibition in statute on sending out the opt-in form with other documents. And then finally, we are encouraging the provision of additional training to districts on the recent policy changes. Again, we're asking districts to reflect on the 2021-22 school year when all of these major statutory changes had just gone into effect. We saw very low levels of understanding of these policy changes among school districts. On the ground, we are seeing some improvement, but we still see a very significant need for training for ISDs on these issues. And then finally, we always encourage communication between schools and parents to ensure that all of the policies around sex education are meeting parent preferences related to the instruction that their kiddos are receiving. Next slide. All right, so what happens next? So one thing that we have not mentioned yet is that this opt-in policy was actually put into state law with an end date. In the policy world, we call this a sunset. So this requirement for written parent consent for sex education was only put in place in state law through the year 2024. Now, in contrast, the opt-in requirement for abuse prevention is in state law for perpetuity. So we just wrapped up a legislative session in May. That was our 88th legislative session. And we saw a number of different bills filed that would have made the opt-in provision for sex education permanent. None of these bills passed into law. Some of them came very, very close to passing, but none of these bills actually passed into law this year. So we still have the opt-in provision for sex education that is prepared to sunset in 2024. However, we do expect some of these bills to return in a special legislative session. Our crystal ball is currently indicating that we can expect a special session in mid-October that will affect several public education issues, and we could see these opt-in bills coming back. We did see several other pieces of legislation related to sex education in the 88th session, but none of those passed into law. And we'll talk a little bit more about how you can be involved in that in a future slide. So what are our next steps for research? So, again, like we said, there's no STAR test for sex ed. There is no statewide database that tells us what school districts are teaching what or what the opt-in rates are. So it falls to researchers and nonprofits like us to continue to try and collect this data. So we are continuing working with school districts to try and get more data on the actual opt-in rates. This graphic is just one example. This was a school district in West Texas that actually implemented opt-in in the 2022-23 school year. And you can see that in most of their campuses, their opt-in rates dropped by about half. So this type of data is very important for us to go back to policymakers and be able to indicate the impact of these laws. We're also working on building databases outlining which sex education curricula, if any, our school districts are using to teach sex education. We're always working on keeping a pulse on public opinion around sex education to assess if any attitudes are changing. We have seen some shifting discourse around sex education since 2021, although we do still see continued strong parent support. And then finally, any of you who work in a field that involves demography, you know the sorrow of the long wait for fertility data. So the most recent data that we have on teen birth rates is from 2021, when we're looking at a regional level. But we are hearing kind of rumblings. We're hearing early warnings from our partners on the ground that they are seeing increasing rates of teen pregnancy. We're hearing from our school district folks who work with pregnant and parenting youth that they're seeing increasing rates of teen pregnancy. So we're looking at some of those early data signals to see if we can expect an increase in teen birth rates for the first time in many, many years. Next slide. So how can you be involved, and what resources are we putting out there for school districts and communities? So Texas is Ready is an initiative of Healthy Futures of Texas. And this is an initiative to support both communities and school districts in implementing high quality sex education. We have a wealth of resources on this website. The two images that you see here are our community advocacy toolkit, and then our school district resource guide, which is intended for school district administrators, health education professionals. These are all free and readily available for use. We also offer significant services to school districts, to communities, to help overcome some of those barriers to implementing good sex education. And we also need folks who are interested in advocating on these issues. We have sign-up forms on the website. You can stay engaged. We'll send you updates and keep you in the loop on what's going on at the policy level. We also offer webinars, usually twice a month, on a variety of issues around sex education in Texas for a broad variety of audiences. Next slide, please. And then we also have ICHAMPS. This is a really wonderful tool that was developed by UTHealth, Houston School of Public Health. And this is a tool that was built to support systems level change via a decision support system. And it includes a broad wealth of tools to support adoption, implementation, and maintenance of sex education and tools. Healthy Futures of Texas partnered with UTHealth to update this tool to reflect the new health education standards and statutes. So it fully aligns with current law. Some of the most useful tools for school districts are downloadable templates, things like opt-in forms, parent notification letters, just lots and lots of resources to make school districts' lives easier when it comes to implementing high quality sex education. And next slide, please. And that brings us to the end of our presentation. We'll have about 12 minutes for questions and discussion, but we do have the link to the full opt-in report here, and also contact information for Dr. Peskin and I. We would love to hear from you or be a resource. So please don't hesitate to reach out.
So thank you so much, Jen and Dr. Peskin, for an excellent presentation. As Jen just mentioned, we would love to hear any of the questions that you may have about the presentation. So please use your chat and share any questions you may have. I will kick off. We have one question to start our discussion. Jen and Dr. Peskin, how will your evaluation then be shared with legislators who wrote and voted for this law, specifically, the barriers and difficulties encountered by districts, excuse me, and the overwhelming preference for opt-out and the qualitative feedback, yes. So how will you share these findings with our legislators?
Yeah, absolutely. So one of my hats is I'm a lobbyist, a nonprofit lobbyist. And so I have been taking the results of this research, which was actually complete in the spring, and have been taking it and sharing it with lawmakers to make sure they're aware of these factors, and then also working to support stakeholders from within school districts or community health educators, and kind of helping them reach out to their lawmakers to share their personal stories. I always say I can share the data and the numbers until I'm blue in the face, but if I have one health educator sharing a personal story, that's what can actually change hearts and minds.
Great, thank you so much. So encourage everyone, feel free to chime in with questions. One question I have, one, I find interesting the parallels. I've done some digging into the literature and with some of my work on substance use and opt-in procedures, and we see similar findings that often, less than 30% to maybe 50% return the opt-in, the consent, and then also just disparities, as you all pointed out with your findings as well, for it's often students who may be more at risk that aren't always opting in. I appreciated that you all, so where we are right now, and despite your excellent findings underscoring that over 80% felt opt-in would be a barrier, a high percent who prefer opt-out, and I just want to underscore how well your generalizability of your sample across political affiliations and geographic affiliations as well. But this is where we are right now. And you also had a good question on facilitating factors for folks who are working with opt-in. So I'm just curious if you all have any plans in the interim to be able to share some of these strategies of how could we, if we have to work within this legislation, how can we opt the opt-in, recognizing the vital importance of sex ed for our students?
Yeah, I would just add that I think, especially in some of the resources that we shared here at the end, there are a lot of good resources here about how that sort of the purpose of those resources is to, within what we're working with now, how to facilitate if you want to implement sex education, how can you do that, and what tools can help make it easier for you to do that. So this slide here, and then the next slide as well, include tools to help you do that.
Mm-hmm. Yeah, and we do a lot of training for school districts and health educators to try and share some best practices on getting those permission slips in. But really what we're hearing is that there's no shortcuts, and typically the answer is extra time. I have a teenager who's taking a health class this semester. He'll be getting sex ed, and his teacher told the class, if your form doesn't come back one way or the other, I'm picking up the phone and calling your parents. So little things like that, but it is extra work on the part of the teachers in the schools.
And I think it also has to be, a commitment from the school where it's okay to use your time to spend, calling parents.
Mm-hmm.
Great, thank you. So one of the questions we have from our audience, is there any evidence of schools putting barriers in place to make education more inconvenient? Go ahead.
I have not seen that. So one thing that we didn't go into a lot in this presentation, just because it was the scope wasn't broad enough. School districts have a lot of latitude in the instructional materials that they use to provide sex education. So by the time a school district is actually teaching health class and sex education, they've been through a very long process involving a vote of their school board to implement those instructional materials. So I think, they're not teaching one curriculum that's been mandated from above. There's a lot of local control in that.
Great, thank you. Another question we have here, are you only able to request data collection from schools, or do you have leverage or financial support to get them to collect some data points for more robust research? So I guess, go ahead, Dr. Peskin.
Yeah, so I think that is what we're trying to do, is to obtain some funding to be able to do that. There's no mandate to collect that data, and just asking, like we did in the survey, to report on data. It takes some time and effort to set up those spreadsheets to document, how many students returned forms and how many students don't return forms, and that takes time and effort. And so it really needs to be, I think we need some additional resources to really assist school districts to do that. But I know it's something that, Jen and I are really interested in exploring further and really trying to obtain, more systematic data, on this policy. I don't know, Jen, if you have anything more you want to add on that.
No, I'll just say it's definitely a challenge for districts, and we'll see districts where the health education coordinator is telling all of their health teachers in the beginning of year to collect the data, and at the end of the year when it comes time to actually get the numbers in, it can be a challenge. We know that our educators are so busy right now, they have so much on our plate, and adding one more thing to their plate like data collection is a challenge.
Great, thank you. And I'll just share there's other similar questions that have interest in this overall topic of how we can get better data on the opt-in versus opt-out. So good. And here, more questions, right? Recommendations for teen pregnancy data sites or connections to use or gather data. So I think a lot of interest here of how we can do a better job getting data. Please, Jen.
I'll just put in a plug for our Healthy Futures of Texas website. And again, Healthy Futures maintains Texas is Ready as an initiative. We have on our data page teen birth rates for Texas counties going back to the 90s. We have PDF county fact sheets for the 40 or 50 largest counties. So a real kind of wealth of adolescent health data on our website there.
Great, thank you so much, Jen. And I appreciate this question because I saw that you also had kind of a diversity of folks who were still doing opt-out, it looked like, who responded, and opt-in, if I recall. Maybe it was about a third. And so the question here, is the law currently opt-in only, or can the school district decide between opt-in and opt-out? Can you share a little more? And if I could add, is there, what are the penalties of not following opt-in?
Absolutely. I always say it's a little bit of the Wild West out there. The law does require opt-in for public school districts. Private and charter districts can make their own decision on it. But really we rely typically on community members to see if school districts are complying with that. It's a long process if school districts are not.
Thank you, Jen.
I was just going to add that the data we collected from the 2021-22 school year, that was the first year that the policy went into effect. And so some people were still implementing opt-out, probably simply because they didn't know that it was, they were required to do opt-in. And so that sort of just points to sort of the confusion I think that people still had regarding what they were supposed to do.
Great, thank you so much. And appreciate this next question. I had the same question in terms of how the parent opt-in form is delivered. So this question is, why is the parent's approval, and you all touched on this in the beginning, opt-in form not a part of the student's enrollment registration paperwork to school to ensure a response? Could you all speak to that? And it sounds like that's baked into the legislation.
Yeah, that is baked into the legislation. So I think the legislative intent there was the idea that they didn't want parents to be blindly signing forms that they weren't reading. But as a parent myself, I would far rather have all of my permission slips in one place where I can read them all, think about them, and sign them, and not have a form that might not even get to me. So that is definitely something that my organization has as a policy priority.
Thank you, Jen. So I know we're down to 1 minute here. One more question. Interest in knowing if you observed any trends and opinions by political party or by type of sex education program being delivered, abstinence plus versus abstinence only. I'm not sure if you all asked questions about what type of program they were. And I know you asked the specific name of the program, but any other insights here? Any trends by political party or by the type of program that schools are implementing, or if that might be a future.
Yeah, we really didn't see any trends there in terms of differences. So.
Okay, great.
And you see really strong bipartisan support for sex ed in all of our polling data.
Great. Well, thank you both. I know we're just at one o'clock. Any final comments, Jen or Dr. Peskin, as we conclude an excellent webinar?
I was just gonna, it's been a pleasure being here today, and thank you again to the Dell Center for giving Jen and I this great opportunity to share the findings of our evaluation work.
Yeah, thank you so much. It's really been a pleasure. And please sign up for alerts if you're interested in staying engaged.
And please feel free to contact us if you have any questions.
Great. Thank you both again. And for everyone attending the webinar today, please know that our webinar will be archived on our website at msdcenter.org. So thank you all for joining us, and we'll look forward to seeing you again the next time.
Thank you.